Good morning. Thank you for joining us for this webinar. This is a recording of a live webinar that we conducted on Monday. This webinar is going to cover a brand new initiative for free person-centered training all across Colorado. This is an initiative by the Colorado Department of Healthcare Policy and Financing, Support Development Associates, the Council on Quality and Leadership, and Alliance in a coordination capacity. With that, I'm going to introduce our speaker, Michael Small. Michael is the chair of the Learning Community for Person-Centered Practices and a partner in Support Development Associates. He's the co-developer of Essential Lifestyle Planning and has worked in 47 states and 6 countries. Michael has written extensively on issues relating to supporting people with challenging behaviors, person-centered planning, and the challenge of changing our system to one that will support self-determination. He's been a research assistant professor with the Department of Counseling and Personal Services at the College Park campus and a clinical assistant professor with the Department of Pediatrics at the University of Maryland School of Medicine. Michael and Mary Lou Borden are the co-designers of efforts to develop person-centered systems. Michael and his company, Support Development Associates, have conducted multiple trainings here in Colorado already, and we're really excited to be working with them on this ambitious schedule of trainings coming your way over the next few months. With that, I'll turn it over to you, Michael.
Thank you, Ellen. And as you heard, this effort is in response to a request from and is funded by the Colorado Department of Healthcare Policy and Financing. And it does reflect a partnership. It's a partnership between the Alliance, the Council on Quality and Leadership, Support Development Associates, and for all of the training that's being presented by Support Development Associates, it reflects materials developed by the Learning Community for Person-Centered Practices. So let me start with some background. Let's take a look at why we're doing this, beginning with the Home and Community-Based Services Setting Rule, looking at person-centered planning, and then looking at the role of person-centered thinking in the work that we're doing. So if you look at the slide in front of you, this is a piece of a presentation developed by the Administration for Community Living to describe the Home and Community-Based Setting Rule and what its intent is. And it's seen as the most important change to the Medicaid waivers since they were created in 1980. It's also seen as an opportunity to fully realize the promise of the Olmstead decision and the Americans with Disabilities Act. This also reflects part of the optional, the Affordable Care Act, and it's really about 4 main ideas. It's about what matters to the person, what we're describing as what's important to the person. And it's about helping people have meaningful days while managing risk and acting on the learning. And it also reflects an expectation that goals reflect what the person wants, that goals relate to specific areas of life that the person would like to either maintain or change. If you look at what matters to the person, the home and community-based setting requirements say that we need to focus on the nature and quality of people's experiences. We have to maximize opportunities for people so that they can have access to the benefits of community living and opportunity to receive services in the most integrated setting. It's not about bricks and mortar. It's about what matters to the person. And it's about how do we help the person have more of what matters to them be present. And that requires that where the person lives and how they spend their day supports access to the greater community and is part of the greater community. It also reflects an expectation that people will have opportunities to seek employment and opportunities to change employment. And that during everyday life, they'll be part of the community and they'll be able to control their own personal resources. And they summarize it in the setting rule by saying that people receive services in the community, people have access to the community to the same degree as individuals who aren't receiving Medicaid-funded services. You can summarize this work by saying that people should have informed choice about who supports you, that is, which organizations provide you with services, where you live, who you live with, what you do with your time, what you do with your resources, and how supports and services are provided for you. An informed choice suggests that there's options for people, that they're choosing from among services that they find preferable. In order to make that informed choice, we have to engage in person-centered planning. And the definition that's in front of you says it's grounded in demonstrating respect for the dignity of all involved and seeks to discover, understand, and clearly describe the unique characteristics of the person and discover what's important to the person, what matters to the person. Where is the balance between what matters to the person and issues of health and safety? How do we make sure, therefore, that the person has positive control over the life that he or she desires and finds satisfying? And it also says that people should be recognized and valued for their contributions to the community. And those contributions that need to be recognized include past contributions as well as current contributions and potential contributions. If we're successful, people will be supported by paid services, but also within a web of relationships, within their desired community and neighborhood. In order to do this, many things in the system have to change. We have to work on alignment of policies and practices, funding and procedures, but that's outside of the scope of this work. This work is intended to bring the skills needed for developing good plans and implementing good plans to those who need them. Developing good plans requires a set of skills, which we refer to as person-centered planning skills, but implementing requires person-centered thinking skills. And if you think of the number of people who need to know how to write plans, it's a very important but reasonably small group. If you think of the number of people who need to implement plans, it's a much larger group. So we need both the planners and the implementers to have the skills necessary to be successful in their work. And that's what this initiative from the Colorado Department of Healthcare, Policy and Financing is about. How do we bring those skills to those people who are interested in receiving them? And so we've designed a series of training, a series of sessions, which are going to be available to all of you across the state. So if we look at those sessions, the first is an introduction to person-centered thinking, a one-day overview. The second is a 2-day training around application and guided practice. The third is how to support coordinators in developing outcomes that reflect what's important to the person. Then, how do we empower families and the people who use services by helping them develop their own one-page descriptions which they can use in advocacy? And we want people to have an opportunity to see how the personal outcome measures developed by the Council on Quality and Leadership also provide us a path of discovery which leads to good plans and good implementation. And that includes people who communicate differently. So if we go into a bit more detail for each one of these, the introduction to person-centered thinking is really designed for those people who are not doing the day-to-day work. It's open to everyone, but we strongly recommend that those people who are doing the day-to-day support, people who are writing the plans, and the people who are their managers go to the 2-day training. This training, though, is designed for senior managers, people who work in settings such as human resources, finance, people who need to understand what is happening or what needs to happen for implementation to occur, but are not themselves engaged in the day-to-day work. So they will learn that core skill, that separating what matters to the person, what we're describing as what's important to the person, those things that make the person happy, satisfied, fulfilled, content, and comforted, and separate those from those things that we describe as important for the person, not only issues of health and safety, but those things that make the person a valued member of the community. And in the process of doing that, look at how the CMS Final Rule creates an expectation that people will know this and how that impacts on services and supports. We also want everyone who's taking this training to understand while we are supporting informed choice, we're also recognizing that choice has boundaries. And the real question that we need to address as we support people is the boundary for the persons, are the boundaries for the people we are supporting different from the boundaries for typical citizens? And if so, why and how? And to see that this work applies across the lifespan, across issues, and so to take a look at a set of one-page profiles that say from 3 months to end of life, describing what's important to the person, describing what we like and admire about each person and how to support them matters and is helpful. So the next course is the 2-day person-centered thinking course. And again, it begins with looking at important to and important for, how to find the balance between them, but also helps people look at how to engage in discovery and how to engage in discovery in a way which is rooted in conversations so that you can learn the information you need about what's important to, what people like and admire, and how to best support without it being an interrogation or an empty set of documents that collect information but don't describe the person. And how do you organize and synthesize this into a one-page profile? The 2-day training gives people those skills and then asks them to practice it so that they leave with competency. And it is the training we recommend, again, for people who are doing direct support, for people who are managing those individuals who are engaging in direct support, and for the people who are support coordinators. It's also open to anyone who wants to attend, and they're certainly welcome to be part of it. The next training is that for support coordinators. And we expect the people who are going to this training have attended the person-centered thinking 2-day training or the 1-day introduction. So they're coming into this with an understanding of what's important to, what's important for, how to engage in a process of discovery to learn that. And we're then focusing on how you can write outcomes that reflect what's important to the person and are in compliance with the requirements that CMS sets forth and the state of Colorado. And how to do that in a way where you recognize that choice has boundaries and you are managing and mitigating risk, but you're not unduly restricting the person. And finally, how one-page profiles can be very helpful as the first page in a plan and help us actually discover and direct the outcomes. We then come to the trainings that the Council on Quality and Leadership is going to be offering. I'm sorry, I almost skipped the families planning. So a very powerful tool to give families and self-advocates is a one-page description that, again, details what we like and admire about each person, what's important to them, and how to best support them. And when people have developed that for themselves, we've found that they become much more powerful advocates. They can then go to service providers and say, how are you going to deliver on this? Service providers who are seeking to support people in the ways described find that families become powerful partners and are much more likely to engage in a way where you're moving towards the same agreed upon outcomes. So we strongly recommend that those of you who are listening to this encourage families to come to this training, and it will be offered at times and in places that we hope will be convenient for those families who find themselves being very busy with everyday life. Those people who use services are welcome to come with their families or with some support and may find that they can develop their own one-page profiles in this process. The next training is the one I was referring to earlier from the Council on Quality and Leadership about using personal outcome measures to discover what's important to the person, to discover what matters to the person, and to look at how to focus the person-centered planning process and develop a draft of a plan using that information. It's appropriate for all of the audiences. It is not a training that replaces or supplants the person-centered thinking training. You can easily come to both and learn two different approaches to coming to the same conclusions, to developing the same kind of planning process. And I think those who are able to come to it will find it a powerful way to begin to develop person-centered plans. One of the challenges that we frequently run into is people who communicate differently are mistakenly seen as less able to tell us about what matters to them. But there are ways to improve listening skills. There are techniques which allow us to engage in discovery where we are listening to the person's behavior and we're listening effectively then to how people communicate differently. So this is a training for those people who are interested in developing better plans and better outcomes for people who communicate in ways other than using words. And again, is a full-day training and would be very powerful for those individuals, for those staff who are doing that. Well, that's a brief synopsis, a brief overview of the training that's being provided. There are a few other pieces that I want to address, though. First, we are asking that when you come to the training, you'll be given the handouts. They'll be tabbed, they'll be 3-hole punched, but they won't be in a binder. If you can bring your own binder, and many of you have been to trainings where you've gotten binders. I am sitting in my home office looking at a dozen binders that I could easily use for one of these trainings. So if you can bring your own, if you have more than one that you can spare, bring 2, bring 3, and let's recycle the binders. If you're interested in attending the training, if you're interested in hosting the training, please contact Ellen, who did the introduction. Visit the registration page, which should be up, we hope, next week, or visit the Alliance website for updates. And Ellen, can you give people any more instructions about how they might participate, register, attend, come to one of these trainings? I think we have quite a few tentatively scheduled.
We do. So as you all are hearing about all these great classes that are going to be offered, I'm sure the first question coming to the top of your mind is, when are they going to be offered and when are they going to be in my community? We are working hard on a tentative schedule that's in the final stages of drafting and approval. Once the tentative schedule is approved, it will be posted on Alliance's webpage that you have there on the screen, and the registration site will go live, and we'll also have a link to that on Alliance's webpage. These courses will be offered statewide, and Alliance is being subcontracted by SDA to perform coordination activities for all of the trainings. So we are working with our partners in the advocacy community and trying to use all available networks to spread the word about the trainings and let people know when they're going to be coming to their communities. As Michael said, if you'd like to host and you have a location that can accommodate 40 to 50 people, preferably seated in groups, we'd love to hear from you. You can just email me and let me know that you may have a space, and we can confirm further details from there. As I said, please just check back to Alliance's webpage that is there on the screen for ongoing live updates on this project and links to all the relevant information that you may need to find out when they're coming to your community. We also have a question submission form on our webpage now, so if you have further questions, you're welcome to submit them via that form. They will come directly to Alliance staff. Alternatively, you can just locate our email addresses on the website or use the one on the screen. Michael just advanced the slide. So we've got a couple of contacts here at Alliance, Kylie Campbell, our membership coordinator, and myself. And then we have a couple of contacts at SDA if you have further questions about the curriculum or any other details that you feel they could better answer for you. And I think that covers most of it, Michael.
I think it does. We also had, during the live presentation, a set of questions that people asked, and I think the questions and the answers are also going to be posted.
That's correct. Yes, we're working on filling in all the questions and answers that were asked, and in addition to that, that'll be kind of the start of an FAQ form that we'll keep on our webpage. And so we'll be adding to that ongoing as we receive questions that might be helpful to the full community to have answers to.
And I guess the only other piece of information I would add to this is if you're interested in hosting a training and you are thinking that you want to actually have a really large group of people come to the training, and you have the site available to have 70, 100 people be there, we can accommodate that by having more than one trainer come to participate in that. It just requires more coordination on our part, but that's something that the folks at Alliance and the people at SGA would be happy to do. And I think that brings us to a close. So thank you very much for listening, and we hope to see you at one of the trainings.
Wonderful. Thanks, everybody. We hope to hear from you and see you soon.